For today's event, we are joined at the table by Premier Dwight Ball and Dr. Janice Fitzgerald, Chief Medical Officer of Health. The Honorable John Hagee, Minister of Health and Community Services, is joining us via Skype from Gander. Please stand by. Our news conference will begin shortly. Our news conference will begin shortly.
Good afternoon, everyone, and welcome back. And we will start this Friday's media availability with the opening comments from Dr. Janice Fitzgerald.
Thank you, Premier. Good afternoon, everyone. Thank you for joining us today. Since the media advisory yesterday, we have no new positive cases in the province, and our total number remains at 261. One person is in hospital due to the virus, and 256 people have now recovered. In total, we have tested 12,952 people. We are now only a couple of days away from entering Alert Level 3. This is a significant step and one only made possible through our collective actions and efforts. We did very well in Alert Level 4, and I'm confident with the same dedication and diligence we will do just as well in Alert Level 3. If all goes well, we may be able to move from this alert level a little faster than 28 days. While we know COVID-19 will be with us for some time, I think by now we have discovered we can move on with our lives, with the loved ones we love, doing the things we enjoy, as long as we do it safely. As we begin moving about more freely, it will still be very important to stay at home when unwell, practice proper cough and sneeze etiquette and hand hygiene, and maintain a safe physical distance of 2 arms lengths from others while in the workplace and public spaces. Maintaining this distance while out and about may not always be possible. Therefore, it is recommended that you carry a non-medical mask with you or face covering. This is particularly important if you're using public transportation, where physical distancing might not be possible, and these would be such things as buses, taxis, ferries. Please visit our provincial COVID-19 website for the proper way to apply, wear, and remove a mask. And that's at gov.nl.ca/COVID-19. As we prepare to move ahead to Alert Level 3, there are detailed guidelines related to public spaces and gatherings, recreational activities, and businesses and services available on our website. And I'd like to briefly touch on some of these guidelines today. So gatherings of up to 20 people are permitted in Alert Level 3. When thinking about gatherings, I'd like you to remember the words we talked about before: people, space, time, place. Gatherings with fewer people allow for less contact and therefore less risk of transmission of disease. Be sure there is enough space to adequately physically distance. The longer the visit, the higher the risk of spread, and outdoor gatherings have a lower risk of spread than indoor gatherings. Outdoor distance gatherings, such as backyard get-togethers with friends or watching an outdoor movie, is permitted for those who are not symptomatic and with restrictions as follows. All attendees not in the same bubble should be at least 6 feet apart. That's front to back, side to side. The number of people, up to 20 in Alert Level 3 at your distance gathering, will depend on the size of the space that you want to gather in, as it must be large enough to accommodate everyone separated by 2 arms lengths. Providing and sharing food is not recommended, as we know significant transmission of the virus can happen through the sharing of food. And people must practice proper cough and sneeze etiquette, hand hygiene, and stay at home if they feel unwell. When you're thinking about indoor gatherings, really you should still be thinking about your bubbles and close contacts for indoor gatherings. As we move to Alert Level 3, responsible travel within Newfoundland and Labrador is permitted, including to second homes, vacation homes, cabins, cottages, hotel and commercial accommodations, campgrounds, national and provincial parks, and summer homes. Please note that intra-provincial travel is only permitted for those who are already located in the province, and non-essential travel outside of the province is not recommended at this time. Outdoor sport activities such as baseball, soccer, and volleyball for groups of 20 or less, including coaches and athletes, are permitted with restrictions in place. Please refer to our guidance documents on our website at gov.nl.ca/COVID-19 for further information on how to do this safely. Gym and fitness facilities, yoga studios, indoor tennis and squash facilities, arenas, indoor pools, indoor gymnasium and court facilities, dance studios, and performance spaces will remain closed in Alert Level 3. As businesses reopen, we fully expect to see an increase in public transit usage. Transit users are encouraged to practice physical distancing of at least 2 arms length from other passengers if it's possible. When physical distancing is not possible, it is strongly recommended that passengers wear a non-medical mask or other face covering that covers the nose and mouth. Public transit buses may allow a maximum of 19 passengers on board a full-size bus at any time, and 50% capacity for other size transit buses and vans. Beginning on Monday, retail stores, including those in shopping malls, will also reopen with restrictions, as will personal services establishments, including spas, aesthetic services, hair salons, body piercing, tattooing, and tanning salons. Moving from Alert Level 4 to Alert Level 3 is a significant transition, but one I believe we can make smoothly by following the public health guidance in place. As I've mentioned, the details I've provided today are just some of the operational requirements in Alert Level 3. For full detailed operational guidance on these and many other activities, please visit gov.nl.ca/COVID-19. As a recap for those who may have just joined us, we have no new cases since yesterday's media advisory, and the total number of cases in the province remains at 261. As I reflect on the incredible progress we've made over the last number of months against COVID-19 in our province, I'm once again filled with tremendous gratitude and appreciation for the devotion, patience, and trust in our public health system you have so readily shown. While where we are today is a true testament that as long as we put our collective minds and energy toward even the most difficult hardships, we will not only overcome them, but will do so with strength, hope, and resilience. So hold fast, Newfoundland and Labrador. Thank you.
Thank you again, Dr. Fitzgerald, and no new cases. That's good news, of course, leading into the weekend. And we must remember again, though, that no new cases does not mean that the virus isn't here. So just don't let that number fool you. The fact is, the reason that we're seeing these results are as a result of the great job that you were doing. And it kind of reminds me a little bit about a story of my grandfather growing up, and he would take us on little trips and so on. And one of the things that he'd always do, he had a quick pace in the step, and he used to always remind us, come on, guys, you're moving at a pace like coal molasses. And that's what we've got, this virus, moving around our province as a pace of coal molasses. That's a good thing in this case, though, however. So I encourage you to keep up the great work, and you can successfully move into Alert Level 3 on Monday, as Dr. Fitzgerald has already said. So if you have any questions before Monday rolls around, there's a lot of information on the COVID website. I'd encourage you to go there. It was created for you for examples just like the information we're sharing with you today. It's a permanent space where that is trusted information. It's informative, so I encourage you to visit that website. And speaking of information that's coming your way, there's a lot of moving parts right now as we gradually bring back some normalcy into our lives as we learn to live with COVID. For instance, on Monday of next week, we are starting the process of gradually increasing the number of public sector employees in government offices and locations around our province. So our plan is to bring staff back, which will follow the same safe and measured approach that we've taken with the public health measures to date. So people will come back gradually. So again, to keep in mind, this is not about a return to work. These employees have been working. This is really about increasing their workplace presence. So many employees have maintained a workplace presence, like the RNC as an example, those that work at Her Majesty's Penitentiary, various government departments like Transportation Works, who's done a really good job about having about 86% of their employees back. Service NL is another good example. And people that I work with on a continuing basis, the Executive Council of our province, and there are many, many more great examples. So they have been working remotely in a lot of cases to provide the critical public services, and the vast majority of our public sector employees have been working throughout the pandemic, delivering important services to the people of our province. But for those, as you come back to work, this is really just a sense on how it will be rolled out over the coming days. Employees who have been identified as those to return to the workplace, you will be contacted by your supervisors to discuss this transition. As more staff transitions back into government offices and other locations, you can expect to see more in-person services resume. So these are some of the things that have been difficult to do during this pandemic. So you will see updates coming in the coming days and weeks ahead as individual departments and the services that they provide, you will see changes. Updates that will also include information on public services, like an example would be Service NL, who are resuming their services that have not been available to the public since the start of the pandemic. And they will also be coming back as a phased-in approach to a number of in-person services. This will begin on Wednesday, on June the 10th. So the first phase of this will focus on opening 11 full-time government service centers. An example of some of the services that will be resumed will be written testing and practical driver exams, as well as the photos that are often required for new licenses and ID cards. This is an example. Now, the difference with the services as of Wednesday will be one that it will be appointment only. And the reason for this is it protects our staff, but also protects you as clients and recipients of those services. A public advisory just went out about an hour or so ago, and it also provides further details and a breakdown of the phased-in approach and contact information for appointments and questions that you might have. Now, we've made a number of announcements when it comes to supports and resources, one being measures to ease pressures on local businesses. Again, these are the job creators in our society and in our province, so we've made a number of changes to ease the pressures for them. One of the measures has been the red tape reduction initiative to gather feedback from the business community. And a lot of things have changed a lot, so it's important now not only do we provide the financial support, but also the regulatory changes that could potentially make it easier for you as customers, but also on the business owners. So today we're proud to announce that the initiative, the red tape reduction, to help alleviate some of the regulatory burden on the province's business sector. As we restart our economy, it's important we work towards streamlining these processes. So this is a single point of entry for all business stakeholders, the community sector organizations, and not-for-profit groups within our province. So you can complete an online questionnaire or find out more about even written submissions if you want to engage this way. This is all done through our Engage NL, and you can visit their website at Engage NL. Feedback will be accepted into this red tape reduction initiative until the end of August, of course, in 2020. So in keeping with your business community, our marketing department and public health officials have been busy creating new public health materials for businesses to utilize. A variety of posters are now available at the COVID website. They're informative posters, and they're for such things as entering a business, how you keep a safe distance within that business, counter safety at your checkouts, and so on. There's different sizes in those posters depending on what you require. You'll find them again on the COVID website under the Business and Employees tab. So when you click on that, you will see the printable, you can print those off, resources for your business. Now, this is a very useful resource to help you in advance for the prepping of your business for gradual reopening. So the old idea here was to have a consistent message regardless of which business you go into, and as we learn to live with COVID in our province. Now, as we head into the weekend, a reminder that our updates will be provided through a news release on Saturday and Sunday, and we will again pick up our regular briefings on Monday afternoon. Next week will be busy for all your MHAs and members of the House of Assembly. So aside from our COVID briefings, we will be back in the House of Assembly to bring forward legislation in place to further support you through the global pandemic. So as we ease our way into the weekend, I think you should continue to call and reach out to loved ones or someone that you haven't talked to in a while. Reach out just to say hello and check in and see how they're doing. And speaking of calling, yesterday I had a very interesting call. I joined a teacher by the name of Joanne Brothers, and that was in a grade 8 class at Smallwood Academy. This is in Gambo, and they had a virtual classroom that I made a visit to. Now, you want to talk about a teacher who stepped up for her students. It was an incredible discussion that we had, and Ms. Brothers started out the program by talking about and introducing our subjects. And the program was called Small Talk with Smallwood, of course, referring to Smallwood Academy. And this is where she invites visitors to her virtual classroom to talk to students. And what a diverse group of visitors they have already had, so people from the school district to give examples of what education would look like remotely. There were a lot of interest in sports, of course, like you would anticipate from a grade 8 class. Newfoundland Growlers paid a visit, performers even from as far away as Broadway. But this gave me, as Premier of the province, a unique opportunity to get a glimpse of remote learning, what's happening in this province, and answer questions from an engaged group of students. Now, we talked a lot for a long time about COVID and the impact of the virus was having on our province. They asked lots of questions, what it was like to be Premier of Newfoundland and Labrador and my life before politics. They talked about racial equality, something very topical at this time. but even talked about a lot what's happening south of the border on things like international relations. So I want to thank Ms. Brothers and her class for the invitation. This is a wonderful example of the great work that's being done by teachers across our province who are going above and beyond to provide their students with an enriched learning environment, albeit from a distance. So thank you very much. It was a great opportunity for me to take part in the Google Classroom technology that's currently being used. Now, as we head into the weekend, it's a good time to get out and take advantage of some of the fresh air and enjoy nature, especially as today marks World Environment Day and tomorrow is International Trails Day. As Newfoundlanders and Labradorians, we cherish our landscape, as you know, but we also be reminded that it's it is our responsibility to safeguard it for future generations. So I encourage you to get out safely, of course, and soak up some of the positive trail vibes over the weekend. This year's International Trails Day theme is hashtag Trails for All. So if you get an opportunity to get out on trail, take a picture and a post. I know we have in my hometown of Deer Lake, we have some great trails that I take advantage of and use quite frequently when I'm home. So I would encourage you to get out and do the same this weekend. Have a good and extremely safe weekend. And I thank you for this opportunity once again. I will now pass it over to the Minister for his comments today. Minister Hagee.
Thank you very much, Premier. See, Joanne got to you too. She's relentless. Doesn't surprise me. 0 cases. That's great. It shows that we have done what we said we would do, which is to try and flatten the curve, and I think we've been very successful. Level 3 on Monday is going to bring some significant changes to life in general, and a lot nearer what will become our new way of living with COVID-19. Premier's addressed a lot of the business-related things, but there's a lot of questions out there from a health perspective, and I hope to offer some sort of practical comments. So as the regional health authorities start to open up still further, what you will see over the course of the next week or so is particularly changes to visitation. This has been the hardest of any of the decisions that we've had to make, and over the course of the beginning and middle part of next week, the RHAs will make changes to visiting in long-term care and on the acute side as well, and it will be done in a phased way so that people on individual units will have a clear idea of what the art of the possible is. Some units may be able to designate a visiting room for families to meet with their loved one. Others, it may have to be done at the bedside with regard to physical distancing and maybe kind of roommates, as it were, if it's a shared area. But that will come next week, and I'm sure that will help deal with a lot of the distress that we have heard about, which unfortunately was necessary because you've seen what's happened in other healthcare facilities when COVID-19 has got in there. And we've been fortunate to avoid that scenario by hard work and some difficult choices. You will see an increase in the planned activity of the regional health authorities. They're already doing 50% or thereabout more than they were during their baseline COVID period, and that will increase still further. There's been a lot of questions about routine blood work, and that really wasn't on the list for level 4. But as we go into level 3, the regional health authorities will phase that in. Their plan is to do chronic disease-related blood work, cancer-related blood work, and then later on, the kind of much more routine annual kind of thing. So that will come in phases, and the details on how to get your appointments or where to go will be announced through public service announcements. And again, they will differ from location to location. The principle will be the same across the RHAs, though. So you will see, private doctors' offices have always been available for emergency care over the course of COVID-19, but some of the allied health professionals, such as physio and massage therapy, have not, and these will now start to gradually get back to something like normal. The biggest change from the delivery point of view that I've noticed, and it's been a discussion at the the level of ministers, and I'm sure the Premier's table as well, has been around virtual care. We have seen a significant uptake in our older style telehealth, where we have technology built into facilities. And that uptake has been dramatically different for allied health providers. They've been able to provide services to clients in remote or smaller clinics through telehealth from the larger centres in a way they haven't done before. And there's been a huge increase in the number of opportunities there. But the real difference has been around primary care. We've seen 100,000 or so virtual consults now, most of them in primary care, for patients who have been spared a visit to a family doctor's office. In there is also a number of specialist appointments who have also been spared visits to either an office or more likely a regional health authority facility. And that has, I think, contributed significantly to the reduction of exposure. What I want to see is this becoming part of our new normal way of doing business, because both patients and physicians have been delighted with the level of connectivity they've been able to achieve, either over the phone or through technology such as this. And we are keen to keep that going. Indeed, it was a stated aim of the Medical Association to have virtual care as one of its key issues for the next 10 years, and we would support that. On the other end, as it were, old school technology has been 811. The 811 helpline has been in existence for a long time, but it really stepped into the limelight, I think, during COVID-19, where their call volumes went through the roof to several thousand a day. They coped, they did very well, and they become a resource for COVID management. But I think it's also an opportunity now to refocus to their core business, which was to provide out-of-hours, round-the-clock advice for people who had health concerns. We have, in advance of COVID, been working with them to provide virtual care too. And next week, we will be making announcements with 811 about virtual care, which is available through 811 telephone, but also there will be a kind of show and tell for the media about an app that they have developed, which will allow you to communicate with 811 literally on your smartphone, as well as some scheduling options there for virtual care too. And I think this is going to really raise the bar around virtual care for the province, and it would be open to all. So I think that's going to be an exciting thing that we'll be able to bring and show next week. It is the way of the future, and the future for virtual care has arrived in Newfoundland and Labrador. So to sum up, as you come to the weekend and the prospect of going camping next week comes out, I think Dr. Fitzgerald's advice about people, space, time and place is really appropriate and really on point. So in the nicest possible way, Newfoundland and Labrador, keep your distance. And if you can't, put a mask or a bandana on. Keep it up. You've done great. Carry on this way, and we'll be at level 2 before you know it. So thank you very much, Premier.
Thank you again, Minister, and I will now open it up to the media for today's questions.
Thank you, Premier. For the benefit of our speakers, we have 5 reporters registered for today's call. Each reporter will have the opportunity to ask 2 questions and 1 follow-up. We suggest you not ask rumor-based questions. The purpose of these briefings is to address COVID-19 issues. All other government-related issues should be directed to the appropriate department or agency for response. Reporters will ask questions in the order they registered for today's call. Please do not press *1 until your name has been called. Following this, should time permit, there will be an opportunity for single questions. Our first questions today are from Peter Cowan of CBC News. Please go ahead.
Thank you. Minister Haggie, I'm wondering if you can elaborate a bit on the visitations that are going to start to be allowed next week. For example, how many visitors are going to be, are residents in long-term care homes going to be able to see? And for hospitals, will things like partners for after someone's given birth be allowed to stay longer?
Those are all issues that have been brought to us on a regular basis, Peter, as you know, and indeed you've brought up a lot of them The answer is those announcements will be made through the RHAs in a phased way over the course of next week.
Dr. Fitzgerald, you mentioned some guidance for sports teams. I've been scouring the COVID-19 website and haven't been able to find anything. And I know talking to, for example, baseball organizations, they've been quite frustrated about the fact that there hasn't been guidance on how they'll be able to operate safely, and they've been frustrated that they haven't been able to prepare, even though sports will be allowed next week. So can you give some more information about how sports will be able to operate safely and why the guidance hasn't been available?
So the guidance is being developed. Of course, it has to be developed in conjunction with the Healthy Living Sport and Recreation Division of the Children's, Seniors and Social Development Department. And so that's been happening, and there's been lots of discussion and information going back and forth, as well as engagement with sports federations. So there has been some discussion. These documents are in the process of in their final approvals right now, and so they should be available very shortly, or within the next day or two, and any information then will be available on the website.
And another question for you, Dr. Fitzgerald. Provincial parks have said that they're not going to be open for tent camping. What is more risky about tent camping, especially since they've already said, for example, washroom facilities are already going to be open for day use visitors? And how do you respond to concerns from people who feel that it discriminates against people who don't have the money to buy an RV and would rather go tent camping instead?
So that absolutely, Peter, is a concern for all of us, and we want to make sure that we can rectify that discrepancy as quickly as possible. But for right now, we felt that the safest way would be if people had self-contained units. Washrooms are open for day use, but it's more about other communal things such as showers and things like that we were concerned about with regard to tent camping. So that was our reasoning behind it, and we'll see how things go through level 3, and we will hopefully have more information on that as we progress.
Thank you.
Our next questions are from Tyler Dunn of VOCM News. Please go ahead.
Thank you. We've heard from people who will have to be within 6 feet of someone due to work, but are worried about wearing a mask for prolonged periods of time because of things like asthma, heart conditions. How should people with these types of concerns conduct themselves?
So certainly I think, first and foremost, the most important thing is physical distancing. And if physical distancing is not able to be done, then there are other things that can be put in place to reduce the risk of spread. And certainly workplaces have been engaged to talk about those sorts of things like barriers and changing schedules and things like that. With regard to wearing a mask, of course, I can't speak to individuals' medical problems and what that might entail. Certainly, if we would hope that people would not be in a situation where they would have to wear the mask all day long, throughout their whole shift. But it would be meant mainly for situations where you would be placed into where you would come into close contact with someone for shorter periods of time, and that would offer some level of protection for those around you, and for you if other people were wearing a mask.
Okay. And although the amount allotted to this province has yet to be determined, how would local government use the money announced by the federal government today to keep COVID-19 at bay?
Well, the money that was announced today, or not announced today, is really the framework in which is forming discussions that we're having with the Prime Minister. Our discussion started on this particular issue. It's a number of issues. One of 8 would include municipalities, all the things that are being discussed around, testing and contact tracing and how we deal with long-term care sites, the most vulnerable in our communities and so on. So municipalities are included in that broad discussion of about $14 billion that the Prime Minister put a figure to today. So this is about the cost, not the loss of revenue, but about the cost on our many municipalities in Newfoundland and Labrador and throughout the country as well. So this program is just not for our province, of course. It's a national initiative. and the federal government would be participating with the province on a cost-shared analysis on this initiative. So the details have not been fully worked out yet. We have officials with Intergovernmental Affairs, and of course the premiers will be working on this with the Prime Minister in the coming weeks.
Thank you. And if the travel ban remains in place during September, will out-of-province students be able to return for school when the semester begins if in-class lectures are to resume as well?
So certainly right now one of the exemption is if someone is attending for school. So.
Okay, thank you.
Our next questions are from Kellyanne Roberts of NTV News. Please go ahead.
Thank you. Minister Haggie, I know you addressed today saying that visitation changes will be coming next week, mainly with long-term care homes. A recent new mother and a healthcare professional made a post on Facebook that has been widely shared, pretty well stating we have 2 active cases in the province and that there needs to be a need to lift the current policy that's interfering with partners aiding through labor, noting that this increases postpartum depression, anxiety, all the extra support that's needed, all of these things through childbirth. Why has it taken to this point and we're still waiting for next week for more information on these visitations?
Well, level 3 doesn't start till Monday. We are where we are currently with our cases because of what we've done. This is a hallmark of success, and success comes at a price. It's been a price of doing the things we would like to do and we would love to do. On the one hand, there's been the emotional distress of separating families from their loved ones in hospital, but it was done solely with the idea of promoting a greater public good. That balance is swinging. We've done very well in level 4. The arrangements that need to be made through the RHAs are best done in a coordinated fashion, and they will be sorted out over the next 2 or 3 days, and the announcements will be made next week. So I think I would suggest that the difficulty that people have borne over the last couple of months has been worth it because we do have the low numbers we have now.
And I know I repeatedly asked on this question when it comes to the essential workers' wage top-up. The last we heard it was with the federal government. Many of these workers are now feeling like this is just being said and that nothing's actually going to come of it.
Yeah, something will come of it. I can assure our essential workers this, and a large number of people will be the recipients of this. From day one, we said that this program on July 4th would be the last day, and we always said that the checks would be available in July as a program, and the period of time that this would cover would be mid-March to July 4th. It would be a one-time check that will come sometime in mid-July, and will be a broad and a very general program for the essential workers. The threshold on the monthly income is set at $3,000 a month. So those that would have worked through this period and did not make made less than $3,000 a month would be ones that would be the recipients. So we're just waiting for the federal government. We're still waiting for the approval on our program. But yes, this is a one-time payment that will occur sometime after July 4th for those essential workers. And yes, people will receive an incentive for the work that they've done during the pandemic timeframe.
Thank you. We know that through pandemic, domestic violence increases, and we already have a high rate of domestic violence here in Newfoundland and Labrador. The Minister for the Status of Women did note that a central helpline was in the works. I'm wondering if there's an update on that.
Yeah, they're making significant progress with this one line. You need to be able to coordinate. You know, there's information out there now, of course, so you can actually contact people like transition houses or people that supply those services. There is capacity within the system. So first and foremost, I would not want to think that anybody that's find themselves in a violent situation do not have an option. They do have an option. The number is available and capacity is available at transition houses. We also know that there is the Intimate Violence Partners Program through the RNC. That unit is also responding to those that find themselves in difficult situations, and we encourage you to reach out if they need help. So services are available. The last thing we want of people is they watch this watch these interviews is to think that services are not available. They are. The one number is an important tool as well. So right now I know the department is working on putting this one number in place. They've made progress, and I think within the coming days you will see and you will get introduced to what this new number would be like. This will again be additional supports for people that find themselves in violent situations.
Thank you.
Our next questions are from Marie Isabelle Rochon of Radio Canada. Please go ahead.
Hi, I'm wondering, New Brunswick announced yesterday that starting on June 19, people who have secondary residence or family members will be allowed in the province. They have to self-isolate for 14 days. PEI also announced similar measures. Why are we still not there in Newfoundland?
Well, one of the things I think is important to have, real good information on what's happening in other provinces as well. As an example, there's almost this sense that in PEI, if you own a summer property there, that you could actually just go into PEI and move into your secondary residence. Well, that is not the case. You go through a process with an exemption order in PEI, and that could be impacted by even the province or the jurisdiction that you're traveling from to go back to PEI. So right now they are ready to accept travelers from outside the province, those that own that property. We're very cognizant of how important it is, and for people that have property invested in our province, but it's finding that balance. And right now we're at a stage where we need to make sure that we can move around our own province safely, and that at some point when we're ready, to look and accept, people that have made those investments in our province, well, then we'll let that information and we'll get that information and a process out there that could safely happen. But we're not there yet. And first and foremost, you've heard me say many, many times, let's learn how to move around our own province safely first before we open it up too broadly for people that want to come in to visit. We want to get back there. We really do. It's who we are as Newfoundlanders and Labradorians. We appreciate some patience right now as we work through this, alert level 4 to alert level 3, eventually into alert level 2, and we'll deal with issues like those that have secondary residence right here in our province.
But could you give us more detail about why this decision is taken? Based on which scientific data is this decision taken, considering that we have only 2 active cases?
Well, you almost answered the question. The fact is, within our province, with the work that we've put in place, we have 2 active cases. So there's very limited virus or very limited COVID within our province. That's been illustrated now quite a number of times. But yet, if you look to New Brunswick, they quickly found themselves as travel related when COVID moved back into their province by a traveler, and caused some significant spread of COVID within a certain element and region of their province. So this is what we're trying to prevent here in Newfoundland and Labrador. We have a lot of vulnerable people within our society. Our objective here is to work with our public health system, with the officials, and put in place safe measures. So we're not quite there yet. It do require some patience. We could be weeks away, months away, who knows? It depends on what happens in other jurisdictions that will help inform the decisions that we make here in PEI. But we can give lots of examples that have been typically travel related that have brought this virus back into that jurisdiction and caused some significant concern around the spread of COVID. That's all we're asking for right here is a little bit of patience. Let's work through this safely. Let's make sure that we can travel around our own province first without spreading this virus before we open it up.
Thank you. And last question, do you have a timeline for alert level 2? Are we still talking about 28 days also?
So as I just said, it could be quicker than 28 days. We are going to be looking at, the epidemiology in our province, what the effect of the measures of relaxing the measures have had. That's definitely going to take 2 to 3 weeks, but we'll assess that as we move through and make a decision once we have more information.
Thank you.
Our next questions are from Peter Jackson of The Telegram. Please go ahead.
Hi. I'm excuse me. I'm told that at least one campground is all its reservations are going to be hinging on this, an answer to this question. So I need to ask it, and that is, they got clarification that the distance between RVs has to be 30 feet door to door, and then someone said 30 feet apart, and that's not always the same thing if doors are on, the different sides and stuff. So can you just clarify what that means for campers?
Yeah, so my understanding is that it's 30 feet door to door. That's assuming that both RVs are oriented in the same direction, so the door is on the same side of the vehicle. So you have one door, 8 feet of RV, and then distance to the next door of the next RV is 30 feet from door to door.
So, but if the doors are facing the same direction, then how does that work? Sorry.
So
I'm
my
just trying to clarify my
understanding
question.
is that I don't own an RV, and I'm not quite sure how parks work, but my understanding is that generally when they're set up, it's usually the RVs are sort of designed in the same way so that the doors are on the same side, and that they would be set up in a similar orientation in most of these parks. So it would be from the outside of one to the door, which is where the door would be with the camper, and then the distance in the next door. That would have to total 30 feet.
So, Peter, at one point in my life, and I'm sure John is here, and the minister is, he would be we would both be more used to, I guess, using RVs and so on. I know John gets a chance to enjoy his a little bit. I've had to get rid of mine simply because politics have become very busy, and I really enjoyed it when I had time to do that. But I think the reminder here is that we do have a business guidance committee in place that will probably help this park owner, and they would get the information, hopefully, that's required if this is a significant decision that they need to make, and just reach out to the business guidance committee, and hopefully there they can get the required information. We can get this information if this has not been useful today, but we have a committee in place that will be able to do that.
Okay, thank you.
Thanks, Peter.
The other question about nursing homes, we're talking about possibly relaxing restrictions there, but on the other side of the coin, apparently nursing students around this time of year are often going into work at long-term care homes, and some people are wondering, are they going to be tested? Is there going to be any strategy to reduce the risk of these new workers coming in?
Peter, the issue about learners in the clinical environment is actually very topical at the moment. We have a variety of learners who would normally require a practicum in a regional health authority facility of some period, and that could vary from a few hours to a few weeks. One of the challenges about bringing them back in is PPE for them. The exact nature and conditions under which they would return have not yet been sorted out, but it is anticipated that by level 2, learners would be introduced under a staged approach back into the RHAs. And that's a plan the RHAs are drawing up with the various educational groups to figure out who goes when and do we have enough PPE. We're doing better with PPE at the moment. I have to say we seem to have got to a stage now where we've got a couple of weeks of pretty well everything and 34 weeks of some things. So I'm cautiously optimistic that by level 2, we will be in a better position to give you a firmer answer as to when that would happen.
Thank you. I'm hoping I get another question because the first one was sort of a two-parter.
You do, Peter. That clarification.
Okay.
Come on, you go ahead.
Thank you. I've had a reader who says that he's aware of several. This goes back to visitations again at hospitals, and mainly support people. There are a lot of people, he says, that he's aware of that are not going to appointments or procedures because they can't take their sibling or their spouse as a support person. Is that a policy that's still in place?
The issue of support people, Peter, has been crystallized around people with cognitive issues as much as anything else. And we had a very lengthy and productive discussion with the coalition of the Association for Community Living. And that element has been addressed because on paper and in reality, often that support person is actually part of the care team because that's how we define it in terms of decision making. In terms of the specifics of attending outpatient appointments and these kind of things, I couldn't give you anything more than what you've provided, which is an anecdote of someone who said, well, I'll wait till later kind of thing. There are options of virtual consults in those situations, and I am aware that those have happened with the support person, as it were, on the other end of the iPad or whatever. But this is another element of the visit phenomenon that the RHAs will be able to give guidance on over the course of the next working week or so.
Thank you.
Thank you. Since it's Friday, I'm going to give everybody a chance to ask one more question, but please keep your preamble short out of respect for your other media colleagues. First, we have Peter Cowan of CBC News. Please go ahead.
Early in this pandemic, the message was a lot about how dangerous the virus is. A lot of people still are quite afraid, and as many people start to go back to work Monday, what would you say to some of the people who may still feel that it's not safe or that their workplace and having to interact with people may elevate their risk too much?
So certainly that's a valid concern, and I appreciate where people are coming from with those concerns. This virus has been pretty scary and continues to be in some parts of Canada. So, we know right now that our likely prevalence is low, and that the risk in Newfoundland, thankfully, has been reduced significantly. But, you're right, it's not zero. So, and it won't be zero. So we need to think about that. So it really is about changing the way we do things. It's about physically distancing as much as possible. It's about, if you're not able to physically distance, you put a mask on. It's making sure you wash your hands really well, cover your coughs and sneezes, and all of those things that we've been talking about, those public health measures that we can all do ourselves, and staying home if you're sick. If you have symptoms, even if they're mild, stay home, give 811 a call, and see if you need to have testing. Because we know that finding cases and quarantining contacts is one of the most effective things that we can do after the physical distancing and these public health measures, those personal public health measures that we can do.
Thank you.
Next, we'll hear from Tyler Dunn of VOCM News. Please go ahead.
Thank you. Just with the mentioning of some flights resuming in June, Haggie, you mentioned likely the only way we see more cases is through importation. I'm just wondering, is government doing anything to kind of check on those people entering the province to see if they're adhering to health measures or being responsible?
As long as the travel requirements from the chief medical officer are in place, then whatever airport receives out-of-province flights will have a comparable level of surveillance. So one of the challenges that we will have through the RHAs is, for example, identifying folk to go to the international airport in Gander or to go to the airport in Goose Bay, where they haven't necessarily had out-of-province flights. But we'll be working with the RHAs and with the local law enforcement to make sure there's a presence at the airport.
Okay, thank you.
Next, we'll hear from Kellyanne Roberts of NTV News. Please go ahead.
Thank you. Minister Haggie, at the beginning of this, you noted the changes that will be coming for long-term care homes. One of the requests, though, that many long-term care homes have made is that the home itself be considered its own bubble, so that residents can have dinner with their friend across the hall rather than just their roommate. This, in many ways, would help with their mental health alone.
Certainly, the idea of increasing the size of one's social circle has been a topic that Dr. Fitzgerald has addressed through discussions about the bubble and then the expanded household circles. I think one of the challenges is with a large home where you could have, say, 100 residents, it kind of conflicts with the mass gathering kind of approach. We have had discussions with personal care home operators about the idea of extending the size of a bubble. I think there is scope there, and we will probably be able to announce something with more clarity next week.
Thank you.
Next, we'll hear from Marie-Isabelle Rochon of Radio Canada. Please go ahead.
Hi. New Brunswick government just announced that they're making the mask mandatory in any building where public is allowed. Is this kind of measure something that the Newfoundland and Labrador government would do here, making the mask mandatory everywhere?
Certainly at this point, we are not making masks mandatory. We are, however, strongly recommending them in some situations where you will not be able to physically distance, such as, mass transit or public transit. That's an important place. But also if you're out at the store and you feel like there's more people in there than you're comfortable with and you really, we would recommend at that point that that people wear masks. Personally, I think I'd like to see more people wearing masks when we're out at the stores. I have had the occasion to go to a couple of grocery stores and myself in the last little while, and I would like to see some more masks being worn, certainly in those situations.
And our final question today is from Peter Jackson of the Telegram. Please go ahead.
Hi. Dr. Fitzgerald, there was a European study published yesterday in the journal Nature that showed that the bubble strategy for reducing spread, or they call it the repetition strategy, it actually works best of all the reduction strategies. So I want to know, were you already aware of this, or are you simply ahead of your time?
Well, I always like to think I'm ahead of my time, but
So do we.
The last one.
I think, we all realize the importance of, I think everybody realizes the importance of keeping your contacts, your close contacts as small as possible and to keep them as consistent as possible and everybody within that bubble following the same rules. I think, I'm glad, I haven't seen that study yet, but I'm glad to hear that some of what we've been doing has been borne out in those studies. But, intuitively, it makes sense as well. When we think about how these viruses spread, how any viruses spread, really, these respiratory viruses, it makes sense that keeping your contacts small and consistent would reduce the risk of spread. If everybody does it, then it reduces the risk of spread.
Thank you.
Thank you very much. The time for questions has ended. Please join us again on Monday, June 8th at 2 p.m., 1:30 in most of Labrador. Have a wonderful weekend, everyone.
Thank you to conference.